when you look back into history, what you see is that very often it's the user who innovates and not the producer to produce something really new. And so thought with respect to the patients. Well, they have an intense need, and perhaps they are really the source of many of the important innovations. But they're not organized in a way that's useful. So that sort of is the underground thought with respect to the patient initiative that Pedro has started with his colleagues. Now, here's an example of what we mean by user innovation. It doesn't have to be something unsophisticated or sophisticated. It covers the gamut because users of things cover the gamut in terms of their skills. So when you look back into the history of major things that doctors use for themselves, they are the users of those things. So for example, the heart bypass machine was developed by a surgeon, not by firms, because the market initially was too small. So it's really quite remarkable when you look at it how fundamental the role of users is in many places. Now, we then began to measure how much user innovation there is. And what we found out is that there's an enormous, enormous pool of innovators out there. They confront a problem, necessity is the mother of invention, and they solve it in some way. And when you look, nobody ever measured user innovation because producers were supposed to be the innovators. But when you measure it, for example, in the UK, you find out that 6.1% of the population has developed a product or service for themselves. And that is 2.9 million people. In the US, in the UK, there are only 23,000 R&D people developing innovations for consumers. So the ratio is more than 100 to 1. So there's this enormous resource, and the question then is what to do about it. Now, it's also true when you study user innovation across populations that what you see is that they are innovating across every area of interest to them. Medical is one, and it accounts for a considerable fraction in some countries, less in others. But it is one of the areas where people, when you survey them, report that they innovate. So we know it's out there, right? It's out there in large scale. Now, this is also true, in every field, and Pedro put this, or Lyde put this one in, and it's historically the case that whenever you have anything like cars in the early days, this was developed and modified by users and so on. This is a Model T, and you can see the first snowmobile there and so on. And while the user was, for instance, creating that snowmobile, which is in the bottom left, the manufacturer, in this case Henry Ford, was saying, "You will void your warranty, don't do that." And when they made it into a farm tractor, he said, "Don't do that either." And then, of course, he himself began to produce farm tractors and so on and so forth. So this is the history of the matter. Manufacturers in general want large and certain markets, and users often are the original innovators. Now I'll flip over these next two and then mention that this is also true for consumers too. And the first thing that Pedro and I did together, he came to MIT and he said, "You know, Eric, services is about 90% of the economy. And you've been focusing on products. Don't you think that's wrong?" And I said, "Well, maybe it is, Pedro." And so we did together the first study, in this case in banking, and discovered that, again, even in banking, for God's sakes, 84% of the most important innovations in that field, in that service field, are developed by users. Now, the question then comes, why not leave innovation to producers? Number one, many market needs are too small to interest producers. So you've probably heard about orphan drugs, where you have a rare disease and it's simply too small to attract a pharmaceutical company. This is also true for devices and everything else. So people have to serve themselves because manufacturers won't serve them. Second, users often understand their needs better. They can experiment on themselves, and they can in fact see whether what they did works and improve it in a very rapid iteration cycle. And then, as I mentioned with respect to the UK, there are many more users than producers, so they can often cover the innovation space. Manufacturers tend to get stuck into certain directions, as we all do. So do users. But if there's so many users, they cover the ground. They do more in terms of mining out possibilities. Now, why, as my final point, does innovation by medical patients benefit from a community platform? This is Pedro's new idea, and the question is, well, okay, users, patients are out there innovating. Why would a platform add? It does two things. The first thing it does is a platform or a community increases innovation. What we see when we surveyed countries, as you saw, like in the UK, it was 6.1% of the population. If you put people together who have a common interest, like, for instance, snowboarding or a particular disease, and you put them in touch, the amount of innovation goes up enormously because you can help each other. You can run ideas off each other, and often patients are isolated. So the idea of creating some place where they can meet together seems to us to be a very generative idea. And second, there's this fascinating thing, which is user innovators are different than producer innovators in a fundamental way. If I'm a user and I fix something for myself, I fix a medical problem, I have solved my problem. A manufacturer has an incentive to sell something, to diffuse it. They have not solved their problem of making money until, in fact, people buy it. They have an incentive to diffuse. But users' incentive to diffuse is lower. It's what's called a market failure. Basically, if I solve my problem, the extra work I have to do to tell you about it can seem like an enormous burden. And so by adding a community, you reduce that burden. You see, the point is that user innovators, and patients in particular, give away what they do. But then beyond that, it can become a burden to sort of help people adopt what you do and so on and so forth. And you can get tired of that. And so really, if you have a community where these things are shared, you can end up with sort of a much better support mechanism. Therefore, both to encourage innovation, to have people share their ideas, and to have them share diffusion. Pedro thinks, and I entirely concur, that a medical community like the thing that he set up here would be a very exciting idea. So that's all I have to say, and thank you very much.